and prevents the deposition of semen in the vagina. Some of the advantages: it provides highly effective and inexpensive contraception, as well as protection against as sexually transmitted infections. Among the ones we'll describe, this is the only method that not only prevents pregnancy, but also prevents against STIs. Once in a while, I'm sure you'll hear about either from a friend or a colleague about a condom failing. Most failures of condoms usually result from imperfections during manufacture. They say about 3 in 1,000 will have some default. Another area that comes when male the technique. This can happen either when applying the condom after some semen has already escaped into the vagina, or semen escaping from the condom when the male partner withdraws before relaxation of the penis. So those are the two main issues about the during manufacture of the condom itself and during the use of the condom. In typical use, failure rates of the condom can range between 10 to 30% in the first year of use. So here's just a picture of the male condom. So remember always to check the expiration date. Be careful to tear open one end of the condom package. This is to avoid tearing the condom itself. Number 2, make sure that the condom is placed rolled inside out. Number 3, place the condom on the head or tip of the erect penis and leave about a 1/4 inch of the room at the tip. Number 4, squeeze the air out of the top of the top of the condom to form an empty nipple to collect the sperm. This is a common mistake, which can sometimes lead to the condom bursting if you've not squeezed out the air at the top. Number 5, unroll the condom all the way to the base of the penis. And remember, as we said, one of the reasons for failure is when the condom is not removed when the penis is still erect. This can lead to deposition of semen into the vagina and leading to an unplanned or unwanted pregnancy. Next, we'll go to the female condom. The female condom is made of a thin polyurethane material, which is like plastic, and has 2 flexible rings at each end. One ring fits into the depth of the vagina, and the other ring sits outside. One of the advantages is that it is under the control of the female partner and offers some protection against STIs. One of the disadvantages has usually been about the cost. It costs more than a male condom. It's a bit bulky, and it's not as readily available. The 6-month probability of failure during use is about 2.6%. Perfect use of the female condom may reduce the annual risk of acquiring HIV by more than 90%. So this is a picture of the female condom. I've told it has 2 sides. It has 2 rings. This is one ring, and this is the second ring. The ring is squeezed and made into almost into the shape of a number 8. This is what is inserted inside the vagina, as you can see here, and with the outer larger part hanging outside. This is what we meant by it is in control of the female patient. And there were several studies that were done in South Africa where women were given the female condom, and for them the main advantage was that for partners who declined to use a male condom, the lady could use the female condom, and as you've seen, it was quite effective for preventing HIV. So the third one we'll talk about are the oral contraceptive pills. Oral contraceptive pills usually contain two hormones. One is estrogen, and the other one is progesterone. How do they work? They work by changing the thickness of the cervical mucus by making it thick so that sperm cannot penetrate. They also make the inner side of the uterus not receptive to implantation of the egg and sperm. And they also alter the transport of sperm and eggs. What are some of the advantages? These are some of the things that were alluded to. Other than reducing the risk of unwanted pregnancy, they are also known to reduce the risk of ovarian cancer by over 40 to 80%. And this is after even 1 year of use. They're also known to reduce endometrial cancer by at least 50%. So these are advantages to, for example, if you are to talk to a patient and you find out that maybe she has a family history of endometrial cancer and ovarian cancer, and she also wants to not get pregnant and maybe she's in school, this would be a good candidate to reduce the risk of ovarian cancer and endometrial cancer. It's also known to reduce the risk of ectopic pregnancy by 90%. It's also known to reduce the risk of pelvic inflammatory disease by 50 to 80%. And it's also known to reduce menstrual blood flow. So, for example, if a patient comes and tells you, I have a heavy menstrual flow, I use many pads, I get dizzy, my HB is low, but I also want to not get pregnant, I'm in school, I'm at work, this can also be an added benefit. It also helps reduce painful periods and is also known to reduce the risk or can be used in the treatment of patients with benign breast disease and can reduce it by about 30 to 50%. And also in patients who have high levels of testosterone, like in conditions like PCOS, it can even help with acne. Something important about contraceptive pills, remember they cannot be used in just any patient, and that's why I said you'll use that medical eligibility criteria. So some questions that we might ask a patient is if they have ever had a history of blood clots, maybe in the legs or in the lungs. Have they ever had a heart attack? Have they ever had a stroke? Do they have high blood pressure? Do they have diabetes? Do they smoke cigarettes? Have they ever had breast cancer or liver disease? If the answer is yes to any of those, we would not recommend them using oral contraceptive pills. So this is an example of how pills look like. Normally you get 28 tablets. So most of them start on a Sunday. So normally here you'll see the date written Sunday, Monday, Tuesday. So depending on when a patient will start using, they even show the direction when to start using and the flow of how they're to use. And as you can see, this last packet, this last 7 days, they look different from these other tablets. The top 3 rows, these are the drugs with the hormonal drug, the estrogen and progesterone. The last one here, which is white, normally either has a sugar tablet or in some pills has some blood builders. So most people, when you use the pills, for the first 21 days, there'll be no bleeding. Then once they finish the last tablet, they'll get their periods during these 7 days when they are not on the pills. Pills are also very good for making sure the periods are are regular. So if someone tells you maybe my periods are very irregular, but I'd also want a contraceptive method, this is one that would maybe be recommended. So there's also something called the intrauterine contraceptive device. These are devices that are put inside the uterus. So there are two types. There's this one where you can see something that has been coiled around here. This is a copper. It's called copper T. This is a non-hormonal method. And then there's here B, which is a hormonal releasing intrauterine device. An example is one called Mirena. So they're both put inside the uterus, but they have different uses. So IUDs are known to be quite effective. For example, if you talk about the copper coil, this one can be kept for up to 10 to 12 years. So it's quite often used for spacing children. Another advantage of the copper IUCD is that because it is non-hormonal, you can use it in patients who have issues with either who cannot use or have had issues using hormonal contraceptives. The hormonal releasing device, this one called the Mirena, one big advantage is that it can last up to 5 years. So it's also good for spacing children. And it's good for those who have very heavy flows because it helps reduce the menstrual flow. And it's good for reducing painful cramps. And I've told you there are some even that last up to 8 years, 5 to 8 years. So next, there's something called the transdermal patch. This is how it looks like. It can be put on several places on the skin. This is an example of someone being put on the arm, but it can also be put on the shoulder and can also be put on the back. There are some certain places it cannot be put. For example, it should not be put over the breast or over the face or anywhere where there's a skin crease. And usually people put it on for about a week. It releases hormone through the skin and usually has less side effects than the oral pill. It also has the advantage of that you can buy it over the counter. I think they cost about 1,500 for about a month use. And they have the advantage of not having to take it daily. You can be used once a week. So there's also the implant. This is just an example of a lady showing where having an implant and where the implant is put. It's normally put on the inner side of the arm. We have two types of implants. There are some implants that last 3 years. There's some implants that last 5 years. They are highly effective, over 99%. We said there are some that even last up to 5 years, like Jadel. They are convenient in that you don't have to remember to take them every day, and they can be a good option for those people who have heavy periods. Okay. It's also suitable for people who cannot use estrogen. Remember, we said patients maybe who have had a stroke, high blood pressure, issues with their liver, have ever had a blood clot, this one would be a good option. So the last one we'll talk about is something called the 3-monthly injection. It's also sometimes called DMPA. It's one of the most common contraceptive methods in Kenya. One, because it's very affordable, and it's about almost 150 shillings to 200 shillings. It lasts about 3 months. It's normally given through an injection. Another advantage why it is popular is that it allows for a lot of privacy and discretion. It does not have any physical signs that someone is using the method. It's suitable for people who cannot use estrogen. As we said, patients who maybe have blood clots, heart attack, high blood pressure, diabetes. It is safe while breastfeeding. It helps protect against ovarian cysts and pelvic inflammatory disease. It also helps in people who have certain conditions like very painful cramps, like in endometriosis. It also reduces the risk of endometrial and ovarian cancer. One major disadvantage is that it is not a method recommended if you want to get pregnant quickly, or because it can delay pregnancy up to even 2 years. So maybe when we are meeting a couple, maybe who have just gotten married, and they maybe want to get pregnant in like 2 or 3 months, we would not recommend this method. We would maybe recommend the oral contraceptive pills, where someone can get pregnant within a month to 3 months. Yes, so that's basically the end of my presentation. Maybe the best way we can tackle it is maybe through questions. I'm sure there's some myths people have heard over the years, either from their auntie, their friend, their colleague, and maybe there are some things you'd want to clarify. As you've seen, there's no perfect contraceptive method. It depends on the patient, and I've said using that medical eligibility criteria. We talk to the patient, we ask a few questions. It's good to find out if they have been on any treatment. What are their major concerns? How has their menses been before we arrive at a contraceptive method? Thank you.
Oh, yeah. So Lensa is asking about the other patch. I've forgotten the name. The one that you put on the skin shows she doesn't know about it. But you've said we can buy it over the counter.
Yeah, so maybe I can give you some more information. So there's a famous one called Evra patch. Evra patch. They normally one patch goes for about 500 shillings, and it's put once a week. And normally on the last week of the month, someone does not put it on, and that's when they get their periods. So that's I was saying it's about 1,500 shillings. The main advantages is that for people who can't remember to take a pill every day, it has the advantage of you can use it once a week. It's easy to use. You don't need a doctor or someone to put it on. You literally just peel it off and stick on the skin. It's also good for people who have painful periods, heavy periods, or who have irregular periods. The main people who don't use it are, as we said, if you have any of those conditions that we talked about. If you have ever gotten maybe a blood clot on the leg or the lungs, the doctor will ask if you ever had high blood pressure. So we'll also check your pressure with the machine. We'll ask you if you ever had diabetes. We might also check your sugar levels. We might ask you if you've ever had an issue with your liver. But generally, if the answer to all those is no, it's a safe and effective method, also 99%. And the only people maybe who I know also don't use it are maybe people who have any skin conditions like eczema. So, of course, one thing a doctor will ask you, do you have any skin problems or skin allergies? Yeah. Any other question?
Maybe just for curiosity, my name is Catherine Matioli. How does it work when you place it on your skin? does it like have some effects on capillaries, or does it attract blood within that area for it to supply that hormones to the body? And is it a new contraceptive, or it has been in use for quite some times? And what are the side effects?
Yes, thank you. So it's been there actually for quite a long time. It's just that most of these things are not advertised on TV, but they have been available. The way it works is that inside this patch, it has those two medications, the estrogen and the progesterone. Now, instead of it being in a tablet that you swallow, it'll be released inside your skin slowly over that 1 week. Just the same way when you apply lotion, it enters your skin. This one has the medication, and it enters the skin and enters the bloodstream. So as I was saying, it goes now, for example, like this person has put it on their arm, it goes from their arm, and the drugs travel up to the uterus. So it makes it hard for the sperm to enter the cervix. It slows down the egg and the sperm, and also makes it difficult for the sperm and egg to implant inside the uterus. So I told you it's normally about 500 shillings for a patch. One lasts about 1 week. It's good for people who have painful periods, who have irregular periods, people who maybe know they might not remember to take a pill every day, or people who maybe they fear injections, or do not want, or they want a method that they can just go to the pharmacy and buy. This is something that you can just go to the pharmacy and buy. You don't need a prescription. And I've seen a lot of lady doctors like this method, especially if they want something that is quick and easy. And an advantage is when someone wants to get pregnant, they just remove the patch. And usually the periods will come back in about a week. So this is it's a good method for someone who is wants a short-term method. So this one, it's not a good method if maybe you want to space children for like 5 years. This one is good for short-term, maybe like a year, maybe 1 year, 2 years, but maybe not something that you'd use for maybe 10 years or 5 years. That's why sometimes when you go to the doctor, they'll ask you, how long do you not want to get pregnant? Is it that you want to space the children for 5 years, 3 years? Is it that you're going to do a course? Is it that maybe you're traveling outside the country? Those are some of the things now that the doctor wants to find out so that they can help know, should you use something that is short-term or should you use something that is long-term? So I can give an example. If someone wants to get pregnant in 3 months, you'd not tell them to use a coil that can stay up to 10 years. You'd maybe just recommend you can use a patch, because a patch, it's something that you use for a short period. Yeah, so those are some of the questions when you discuss the doctor. How soon do you want to get pregnant? How long do you want to stay? And then the doctor, of course, will ask you if you have any of those health problems. I told you, they'll check your pressure. They'll ask you if you have diabetes. They might check your sugar. They'll ask if you ever had a stroke, ever had a heart attack. But I told you, generally, if you're in good health, you've never had any of those conditions, and you answer no to all of them, it's a good option for people who want something that they can take once a week, and that is easy to use.
Hello. Kindly, are you able to repeat the first 2 or 3 slides before you got to the male condom, so they appear in the recording?
Yes, thank you. Yeah, it was just an introduction. I was mentioning that the decision-making process when concerning fertility, it's a very deeply personal and a very sensitive issue. And it often involves religious or philosophical convictions. It's also important for now us as clinicians or the doctor, when talking to patients, to be very sensitive, empathetic, deal with it in a mature way and with a non-judgmental behavior. So normally we actually advocate for patients to come with their partners if you have a partner. And it's something that we should almost like have a discussion so that we find what best fits you. Remember, what might have worked for one patient might not work for another. So one patient might have loved the transdermal patch. It was very easy to use. But another person, maybe they had an issue. They have eczema. So they felt itchy whenever they put it. So that person, it was not good for them. That's why we say it's always good to sit down and talk with the doctor so that we find out what works for you. This was just an example of the birth control methods that we've talked about. There are a few that maybe I didn't talk about. There's the permanent sterilization. This is now maybe after someone has gotten the desired number of children. We can either cut the tubes for ladies, which is called a bilateral tubal ligation, or for the men, a vasectomy. Now, permanent method. There's also some are not mentioned here. Coitus interruptus. Maybe here I'll make a special mention. It's very popular, but has a very high failure method. Coitus interruptus it was even practiced in the biblical days. This is basically when someone withdraws the penis during intercourse to ejaculate outside. As you can tell, it needs a lot of self-control and has one of the highest failure rates. And that's why maybe I did not mention it too much. Another method I'm sure a lot of you have heard of is called the calendar method. Sadly, this also has a very high failure record. And the reason is because a lot of women do not have regular periods. A calendar method only works if your periods are regular. And sometimes people actually end up having intercourse on the day they're ovulating. So I think that's why I avoided it. It has almost the same level of effectiveness as coitus interruptus. Yet I know these are probably very popular methods, especially if you go on social media. So those are some of the things that also we discuss when a patient comes in. A patient might come and tell you, I'm not worried about anything else other than effectiveness. I just want to use the most effective method. A patient tells, I do not want to get pregnant anytime soon. So that's now when we start, if we're discussing effectiveness, that's when we talk about things such as the pill. That's when we talk about things like the coil, the implant. Those ones are known to be 99%. But let me make a reminder, there's none that is 100%. Even the one that is permanent, I've gotten patients who have gotten pregnant. We've had cases where someone has been tied both their tubes, or a man has had a vasectomy, but the wife gets pregnant. Yeah, but it normally happens in about 1 in 1,000 people. Maybe in my career, I've only seen like 5. Someone who had both their tubes tied and got pregnant. Now those are the 1%. So if someone was to say they want a very effective method, we normally look at the ones that are 99%. 99% are like the implant, the pill, the coil, and the patch. This is what I mentioned. This is what, when you see the doctor asking about advice about contraceptive pills, the doctor will use this device. It's called a wheel. So if you can, I know the image is not very clear. The doctor will ask if you're on any medications. He'll ask if there's any history of HIV, any STDs, if the patient has ever had any infections, if the patient is breastfeeding. So these are some of the questions we ask. Is the patient smoking? I'll give an example. If a patient smokes, they should never use the pill or the patch. So if someone is smoking, or other than advising them to stop smoking, we would maybe recommend they use something like the coil. The coil is non-hormonal. If, for example, a patient was to tell you they are breastfeeding, again, you'd not recommend the pill or the patch because it'll reduce the amount of milk they are producing. So if someone is maybe breastfeeding, you might tell them, okay, maybe you can either use the coil, it's not hormonal, or you can use the implant, the one for 3 years or 5 years. So this one, so basically the reason I was telling you this is that it's not as straightforward as telling someone use this or not. You need to ask them some questions before you decide which method to use. And these are just the goals that I had mentioned for why we give contraceptives: to prevent unintended pregnancies, control the number and spacing of children, reduce unsafe abortion, which usually happens if someone gets an unplanned pregnancy. It enables women to pursue education and employment, and also protects against certain conditions that I mentioned. There are many conditions other than preventing pregnancy. It can help prevent ectopic pregnancy, can prevent endometrial and ovarian cancer, can prevent pelvic inflammatory disease. Women who have heavy periods, it can make them lighter. Women who have painful periods, acne. So if you talk to a lot of dermatologists, they use oral contraceptive pills to help with acne. Yes, any other question?
So one of my friend had asked me, maybe for example, during the menstruation. So if it starts on Monday, maybe sometimes I experience maybe in 4 days, 5 days, so depending. But when it's about to end, and then if you maybe you have you go for okay, well, how can I put it best? You do the intercourse. Are you able to get pregnancy?
Yeah, so that's a good question.
So I want to get it so that I can be able to help my friend.
So, for example, what that person is trying to do is using the calendar method. So, in the calendar method, it is said that in the first 5 days after your periods, it is very difficult to get pregnant because during those first few days, the egg in the lady is still forming. So for people who have intercourse either immediately after their periods have ended, the chances of getting pregnant are low. But remember, I've told you, the reason why we have issues with the calendar method, not everyone's cycle is the same. So I'll give you an example. Your friend might get their periods after every 21 days. Some people get even 2 periods in 1 month. I had a patient yesterday who after 10 days, they get their periods. What that means is they might even be ovulating around the time of just after their periods are over. meaning they can get pregnant. So that's what I meant by the problem with this method, that where you look at the calendar, or some people use an app, a computer app, to check when they are bleeding or not, is that every woman has a different cycle. Some people have periods after 10 days, some people after 21 days, some people even have periods after 45 days. All those people are different. They will ovulate at different times. What I mean by ovulating is when an egg is released from the ovary. So the reason why the failure rate is so high is that your friend might say, oh, my periods come every maybe 21 days, yet they might come after every 45. So the best way to put it is, for someone who maybe gets regular periods, maybe they get one period every month after every 21 days, yes, they would not get pregnant if they had intercourse immediately after their periods. There are what people call the safe days. I'm sure you've heard of something called safe days. Safe days are the first 5 to 6 days after the periods have ended. But as I mentioned, it only works if you have regular periods, one every month, ideally every 21 days. I hope that one was clear.
Lensa is asking something. So if you miss the periods every month, does it mean you're sick?
So just repeat. So just repeat the question.
Sometimes people miss periods. Maybe, for example, you don't have the irregular one. So does it mean it's sickness or it's normal?
No, that is normally a problem. So, for example, a normal period, you should get one period every month, at least 3 to 5 days, and use about 2 to 3 pads per day. If you notice you're getting 2 periods in 1 month, that's a problem. Or if you have 1 period every 2 months, meaning that it is coming very infrequently, or you bleed for too long. Let's say you have your periods for 2 weeks. That's abnormal. Or if you notice you're using 5, 6, 7 pads per day, that's abnormal. Or if you have a lot of pain during your periods, you cannot go to class, you cannot concentrate at work, you always have to buy painkillers, you always fear that your periods are about to start, that one might be a medical problem and should be done a checkup. Some things that we'll do when you see the doctor, we might do a scan to check if the uterus has something called fibroids. Fibroids sometimes can cause painful, heavy periods. And we have mentioned that there's some birth control methods that reduce those painful flow, such as pills, such as the Mirena coil, even the patch. Yeah, so remember, for the ladies, please, you're not supposed to suffer. If you notice you always have to buy painkillers, you are missing work, you're missing school because of painful periods, please come see the doctor.
Hello. I also have a question. If, for example, maybe someone has been having these painful cramps for about 2 years. Would you also advise if that person can go to the hospital or it's late?
No, yes, it's never too late. Remember, we also want to improve the quality of your life. Remember, I've had cases of even female doctors missing exams because of periods. We've had people missing work because of their periods. There are people even who have to run to the hospital to get an injection so that the pain can go down. So remember, all those are signs of an abnormal menstrual cycle. So remember what I said, you should have a period at least once a month, at least 3 to 5 days, and at least maybe 2 to 3 pads per day. And the most that you should use for a painkiller is maybe Panadol. If you start noticing you have to get an injection for the pain, you have sometimes I've heard of women even taking an overdose of Brufen. They take 8 Brufen in one day, yet you should only take maybe 2 in one day. I've heard of women taking an overdose of Maramoja. I've heard of women going to the shower and putting hot water to calm down. It should not be so painful that you are missing your life, work, school. You can't go to a birthday party. You can't go to see your friend because you're having your periods. That is a sign that it should be addressed.
Hello, Doc. There is a question on the chat box. Are you able to see it, or I read it for you?
You can read for me.
So, someone is asking, what if a married man has a chronic illness and opts for vasectomy during his early life, for example, at age of 30? Will the vasectomy be permanent without failure rate?
So that's a good question. So these days, actually, vasectomy is actually becoming quite popular. The reason why it's become popular, unlike the permanent method for women, this one is much easier. It takes actually only like 10 minutes, and the patient does not have to go to theater. So it's become quite popular. Some places it's quite affordable, and the truth is that it's normally a permanent method. So by the time someone has this method, they should have had the number of children that they and usually it's something that they should have discussed with their partner. We don't recommend people doing a vasectomy in secret. One thing we usually, after a patient has had a vasectomy, we test them after 6 months to make sure that it has completely closed to reduce the risk of failure. So we normally advise the men after the vasectomy, after we close the tubes, not to run away. We normally advise them to come back in about 3 months. We check if the tubes are blocked. So this one is also 99% effective. Remember, I've said there's none that is 100%. Let no one lie to you, there's any that's 100%. This one is among the ones that are 99, just like pills and the patch and the coil. Yes, even any myths. Maybe I can pose a question to others. Are there any myths you've had? Maybe I can mention a few myths I've had. There's a common myth, doctors here, that if you use contraceptive methods early, you won't get pregnant. Has anyone ever heard that? I hear it a lot among mothers. If you use contraceptives early, you won't get pregnant.
Daktari, I want to ask on the same. Sometimes you are told about the pills that you take. Is it for the 3 months? the 3 months pills, we are told if you use them for a long time and then you will not get pregnant. Is that true or not?
So yeah, so it's good to clarify the myth. So that myth mostly comes from the 3-monthly injection. So remember, I told you the 3-monthly injection, it's one of the most popular methods in Kenya. One, because it's very affordable. I told you it's about 100 to 200 shillings. And the big mistake that happens, I told you a lot of people don't talk to the doctor before getting this one. A lot of these methods you can get over the counter even without talking to anyone. You can literally go to a chemist and say, I want the 3-monthly injection. But because, let's give an example. Someone has just gotten married and maybe they wanted to get pregnant after 6 months. They went over the counter and got the 3-monthly injection. Now, what they might not know is one issue with the 3-monthly injection is you can go up to 2 years without getting pregnant. So we have a lot of patients, when they find out, they are like, why was I not told? They say, if I had known, I would have just eaten the pills or the patch, since I wanted to get pregnant in a short time. One important thing to know is that it's not permanent. The reason why I said 2 years is that eventually the person will still get pregnant. It is not like permanent. It's not permanent like the vasectomy or the tubes being tied. Yeah, but it normally causes women a lot of distress. So we get a lot of women who come to the clinic saying, I've been trying to get pregnant for the last 2 years. I used the 3-monthly injection. I was not told that I can get pregnant as soon as I want. So normally we realize that those ones are just that the patient either was not advised or the patient had maybe got the method without talking to anyone. But after like 2 years, it comes back. And in some cases, there's even medication we can give to return the fertility sooner. Any other myth? Is any maybe from the chat? Anyone else who has ever had a myth other than the one I mentioned, that using contraceptions can make you infertile? Maybe anything you've heard from your grandmother or auntie or mother. Maybe there's one that I hear about when it comes to the tying the tubes for men, for vasectomy. Some men, there's a myth that after vasectomy they cannot enjoy sex, they cannot have an erection, they cannot have orgasm. So all that is a myth. So the vasectomy only prevents pregnancy. They can still have an erection, you can still have intercourse, you can still have an orgasm. Yeah. So that is a myth that is normally surrounding vasectomy. Maybe another myth I hear a lot is for ladies who tie tubes. Some people say that you won't get your periods again. So remember, when you tie tubes, for ladies, like they say in the permanent method, again, it only prevents someone from getting pregnant. It will not stop you from getting your periods. Your periods will still continue, and the intercourse will still be possible. Maybe any other myth or clarification people want to find out about?
Doc, I have a question, Daktari, about PCOS.
Yes.
So this PCOS, I understand it's a hormonal thing, but now.
Yes.
So I understand it's a hormonal thing, but now, for example, you have PCOS, you're looking for a child or whatever, and now that when you go to the gyna gives you the pills. So will it have any effect?
Yeah, so that's a good question. It's a very common problem we see these days. I think almost you cannot do a clinic without seeing 4 or 5 patients with PCOS. So PCOS is a whole topic by itself, but if I was to summarize, you will find, I'm sure you've ever seen women who either have a mustache or a goatee or hair in their chin. Or sometimes you find a lady telling you, sometimes I get periods maybe only 3 times in a year. They tell you they have a lot of acne. Those are the signs of PCOS. So some of the treatment the doctor might give you is the oral contraceptive pill. So it is good for making your periods regular so that they can come every month. They are good for reducing acne, and they are good for reducing that excess hair growth. For those who come with infertility, after about 3 months, once the symptoms have gone down, once the patient, maybe now the acne has gone, the periods are regular, the hair growth has reduced after 3 months, we can give them some special medication so that they can get pregnant. We normally say PCOS is the most treatable cause of infertility. If that is the only cause, yeah. Of course, remember, someone can have other reasons. They can the tubes can be blocked. Maybe the partner, there are not enough sperms. But let us assume that PCOS was the only problem. It's very treatable. Most patients who have PCOS get pregnant once they follow the treatment regimen. Any other myth? Maybe you don't have clarification before we finish. For those who are shy, they can type. Because I told you it's a very sensitive topic. Some people don't want to know that. You can even say it is your friend. Your friend asked you to type. So I think that's okay. If there are no other questions or types of someone has talked about. I think someone was asking about types of vasectomy. Of course, there are different types of vasectomy. That I told you there are some that are just done in the office. There are some that they tie with a suture. There are some that they use something called like a clip to kind of block the area. There are some that don't even cut at all. So there are many methods. But the main thing that differs is just how much the cost and maybe which hospital it will be done in. But most of them are over 99% effective. I've seen another question. Does celibacy have any negative impacts on reproductive health? I don't think so. They say that, what is it called? Is it Kuchil, the one that was being advertised? Kuchil or celibacy or abstinence, I guess is another word. It is the only method that is, actually, they say that's the only method that's 100% effective. So maybe, as much as I said, there's none that is 100% effective. If you do not have sex, you cannot get pregnant. Yes, but as you can tell, you cannot advise celibacy maybe to a married couple. Maybe there's a married couple who have one child and maybe they want to stay 3 years before getting a second child. You might not be able to tell a married couple to have abstinence or celibacy for 3 years. But yes, abstinence is the only proven method to prevent sexually transmitted illnesses and unintended pregnancies. Any other question I might have left out?
Hello, Doc.
Oh, yes.
I think maybe the person who had asked that wanted to know also, does it have any effect on reproductive health?
I don't. I think the simple answer would be no. If anything, it has positive effects. But I would say maybe it might affect socially, but does not have negative effects on the reproductive health. For example, celibacy does not cause a medical. I don't think there's any known medical conditions that it would cause or medical health problems. Any other last questions before we close? So maybe just my parting shot is that please, I would highly recommend before using any contraceptive method to talk to your doctor. There are certain questions they're going to ask you. It'll help guide what kind of contraceptive would best suit you. Avoid going and getting contraceptive methods over the counter. You might get one that might actually make your problem worse. Okay. It's something that you discuss with your partner. Remember, there are some that are short-term, 3 months, some that are long-term, 5 years, 10 years. So it's something that you need to discuss. Some, as you had, are permanent. Some are temporary. And some of the issues can be addressed early enough. For example, as you said, if you had a patient who had PCOS, you do not give them the 3-monthly injection. If someone had PCOS and has acne, has excess hair growth, has irregular periods, most doctors would tell you the best to use would be the oral daily contraceptive pill. It would not only help with the acne and the hair growth and make the periods regular, but would also be an effective contraception. And for those who want to get pregnant, you can get pregnant even 1 month after, 1 month to 3 months after stopping use. So instead of guessing or when choosing a contraceptive method, please talk to the experts to avoid either unnecessary delays or being on the wrong method so that you can have the maximum benefit. Thank you.
Yeah, thank you, Doctor, for the well presentation. I hope we've all learned and we are not the same the way we started. Yeah, so just take note of the key thing that the doctor have mentioned. Avoid buying avoid going for the family planning methods over the counter. And also it is key to seek medical attention to get advice on which method you can use based on your condition. Yeah. So I think that I can't see any other question from the chat box. And I think we'll just end by a word of prayer. Thank you, Doc, for the presentation. It was really amazing. Thank you, Teacher Editor. You are very, like, I could really read the signs and they were really very clear. Thank you. So I would like now to invite Teacher Sese, if he's here. I think he's also here. Maybe your comment about the speaker and how the session had been.
Hello. Greetings.
Hello, we can hear you.
So, in a special way, I also want to thank our presenter this evening. This was a very informative session, and I believe it will go a long way to help us, especially, allow me to say, the young persons in our group who are still hoping to build their families as they plan both their present and their future. May God bless you, Dr. Riken, and also a lot of gratitude to you, Doreen, Dr. Nafisa, and all the organizers of this very, very, very important and informative sessions that we always have through DEFL. Thank you, Editor, for coming through and for supporting us through the sign language interpretation to ensure that even our deaf brothers and sisters are not left behind on these important matters of health as they continue to build their families. God bless you all.
Thank you, Teacher Sese. So at this moment, I want to invite either one of our deaf here, either Teacher Lensa, or I'm also seeing, I don't know whether that's Samuel, but I'm seeing someone there. I'm not so sure whether it's Samuel. Yeah, if it's not the one, then Lensa, you can just represent now the deaf. What were your comments? What would you advise us to do better next time? Yeah, welcome.
Oops.
Editor, you are mute.
Yes, I have now I'm back. So first, thank you so much. So I have learned some of them are very new to me. I didn't know about the different methods of contraceptive. So I have actually for the patch, that is very interesting. I know most of us, the deaf people, don't know it. So that one is very nice. I will be able to share with my friends if need be. So thank you so much. I will also be able to, whatever we have learned, I will keep in mind and also be able to advise all of them. So equally, I have some of my friend who really wanted to join, but now the problem, I did not manage because of the Zoom. I think didn't have the app, the Zoom app, but we'll see how next we can be able to help them. That one now is for Doreen and the team.
Okay. Thank you, Lensa, for that. And we've noted. Yeah. So next time we are planning to have this session. If possible, we can have them physical session. It will be better. Yeah. So well noted. So I think we can now end it here. Yeah. So I will request Teacher Sese, if you can finish with the word of prayer. Hello. Sorry, you are saying? Oh, okay. Sorry. It's okay. So we'll just pray, no problem. Okay, so let's believe and pray. Father, in the name of Jesus Christ, we come before you again this evening. We are very grateful, Lord, for the information that we've learned, Almighty King of Glory. And we pray, Lord, that may you enable us to share them with our colleagues, Almighty King of Glory. Even as we are planning to have more of this session, we pray, Lord, that may you guide us and bless us, oh Father. As we want to now end the meeting, we pray that may you be with us. It is in Jesus' name I do pray and believe. Amen. Yeah, so thank you, and you are free now.